Again, I'm David Daniel, the Board President of TAMEST, the Texas Academy of Medicine, Engineering, Science, and Technology. Before we go any further, though, I'd like to thank our generous sponsors for their support of this conference, making this meeting possible, especially our platinum sponsor, Breyer Capital, and the Oscar Fisher Prize for their special sponsorship of this event. We'd also like to thank our diamond sponsors, Texas A&M University, and UT Southwestern Medical Center and Southwestern Medical Foundation, and our gold sponsors shown on the screen, as well as our silver sponsors. Again, these are the folks who make this meeting possible, and we thank you. Let's give them a round of applause to express our appreciation. We're delighted to have this eclectic group of leaders here in the room, industry leaders, research and university leadership and faculty, National Academy members, early career investigators, and the protégés of our TAMEST members. The TAMEST work would not be possible if we did not have the leadership from our board of directors as well as key committees of TAMEST. We'd like to thank all of them for their time in support of TAMEST, our state, and our communities. We have 2 board members who have completed their service, and to get that wonderful experience of being thanked for their service, which means they are relieved of the further responsibilities of board directorship, and that's Richard Aldrich of UT Austin and Peter Roski of Rice, who will be rotating off of our board of directors. And now I'd like to introduce this year's conference program chair, which is, trust me, a position of tremendous responsibility and time sink as well, especially when the period of service goes for 2.5 years rather than the usual 9 months, and that's Dr. Nancy Dickey. She's President Emeritus of Texas A&M Health and a member of the National Academy of Medicine. Nancy, thank you, and the podium is yours.
Thank you, David. I'm delighted to welcome all of you to TAMEST 2022, the annual conference, Forward Texas Imperatives for Health. Over the next 2 days, we're going to examine how Texas can continue creating strong, healthy communities, communities of the future, while addressing the critical issues such as healthcare, education, infrastructure, and infectious disease. It's also going to be a significant opportunity for us to examine the COVID-19 pandemic response within the state of Texas, to look at its long-term effects on our communities. And it's a time to have a rich, healthy dialogue about the innovative solutions that have emerged over the last few years. We're going to look forward to hearing from incredible speakers and panelists that we've developed for this conference. We're looking forward to hearing from the recipients of the Edith and Peter O'Donnell Awards and the Mary Beth Maddox Award, all of those occurring today. Now let's see, is somebody doing the slides or am I supposed to do that? There we go. Keep going. The Protégé Poster Conference. There we go. This conference is more than just being about speakers and an opportunity for us to come together on a regular basis and visit with each other. It's also about holding a poster challenge to recognize research within the potential to improve communities. Our contestants come from the TAMEST Protégé program, and their poster entries are on display in the VIA and Zapata rooms right down the hall. You're going to have time set aside this afternoon and this evening to view those entries, and we'll hear from the 3 finalists of the competition on stage tomorrow. Now, the prize for the 3 finalists, in addition to presenting from here on the stage, is a private breakfast tomorrow morning with the President of the National Science Foundation, the Chair of the National Science Board, and Senator Kay Bailey Hutchison. So there aren't big checks, but there are big opportunities to network with important people. So please be sure and go look at the posters, and then as you go through the next day and a half of the conference, to identify the protégés and give them some feedback about the posters that they've presented. We're also thrilled that through the course of the time, we're going to have HEB presenting this contest, and we want to thank them for their support. Without them, it would not have happened. We want to talk too about the program committee. There we go. You heard David say that I'd been doing this for 2.5 years. Don't run when they come ask you if you'll consider being program chair. It's a 1-year commitment, sometimes. We started this the last time we had a face-to-face conference. We were preparing for January of 2021, and then for January of 2022. And we have congratulated ourselves that we're actually here in June of 2022. So it's been a little longer stint than we expected, but I couldn't have worked with any more diligent and committed people. They stepped up to help organize. They said, you know, what can we do if we're not going to have a face-to-face conference? How do we keep this group that are scattered across the state, across our many universities, in touch with each other and moving science forward? So we developed an online series during the first year of the COVID pandemic to convene the research community and share evidence-based science. We're all nudging TAMEST to continue that in some fashion because, believe it or not, some of our members approached the online series even though they don't normally come to the face-to-face conference. So any ways that we can keep our membership involved, engaged in advancing science for Texas, I think is a good thing, and thanks go to the committee. So I'd like to acknowledge each of them and thank them for their extensive service. And again, as you see their names on name tags, please thank them as well. David Daniel, who you've met several times, represented TAMEST and the University of Texas at Dallas. Ellen Gritz from MD Anderson Cancer Center. Adam Hamilton from the Southwest Research Institute. Carlos Roberto Jaén, UT Health Science Center, San Antonio. Ray Pentecost, Texas A&M University. And Michael Walton from the University of Texas at Austin. We brought a broad variety of perspectives because health of our communities is more than the usual interpretation of health. It's about so many things that impact. It's about all those things in medicine that we talk about today called social determinants of health. And these folks brought an extraordinary array of perspectives and potential speakers, making hopefully this conference much richer than it might have been. We also have to thank our honorary chair that served on the planning committee, Dr. Amelie Ramirez of UT Health San Antonio. She's been instrumental in guiding and supporting TAMEST these last few years, and it's fitting that she's honorary chair for this event. Again, my thanks, Amelie, for all the time and energy you put in. This was actually a relatively easy assignment when you have a team like this who are working with you.